This podcast is intended for axial spondyloarthritis patients and has been initiated and funded by UCB Pharma Limited. Information contained within this podcast is not intended to be a substitute for consultation with your healthcare professional.
So Sean, tell me, a lot of our patients ask us what actually is axial spondyloarthritis.
It's previously been known as ankylosing spondylitis, but there are also some other terms that can be used, such as radiographic or non-radiographic axial SpA, so it can be a bit confusing. But essentially, axial spondyloarthritis is a form of inflammatory arthritis where the main symptom is back pain, but this can also commonly involve stiffness and also fatigue. And that stiffness can especially be present first thing in the morning. Symptoms often start to develop when people are in their late teens and early 20s, but obviously with delay to diagnosis, it can take some time for it to be diagnosed. It's often very variable, and some patients will have minimal symptoms, but also some will have significant pain and stiffness.
No, absolutely. I mean, you touched on the fact that early diagnosis can be difficult, and I completely agree. And this is what we see in our clinical practice. And the reason why diagnosis I perceive to be difficult is that back pain is very common in our society. And therefore, it's really, really important that we do try and diagnose this much earlier. So therefore, we are able to start treatment earlier. And the treatment can successfully help manage this condition. So treatments will include things like exercise, but more importantly, prior to exercise is education. Our patients understand what their condition is and engage with self-management and well-being. And there are a lot of medications that are out there that certainly do help significantly the outcomes of patients with this condition. And these would include common drugs that we have heard of as anti-inflammatory, and the more broader group of drugs that are being prescribed in hospitals called biological medications.